First off, thank you guys for having me here today, and thank you, Virgil, for the introduction, the opportunity to speak. As Virgil pointed out, after September 11th, I joined the military. Thought it was what I needed to do, and ended up deploying the first time in 2002 to Kuwait as a scout to do reconnaissance. Went back 32 days later for the invasion of Iraq. My unit spent 21 days in consecutive combat. From my knowledge, the next closest unit to us was a Marine unit. I think they did somewhere around 11 to 13 days. So coming back from a combat situation, there's a lot of PTSD, depression, suicide, different things like that. There are a lot of treatments, but a lot of them are just cover-ups, and so that's what I'm here to talk today about. Help give you an understanding as to PTSD, what is actually going on with it, and then some of the numbers that are involved with PTSD. So we'll start off with the numbers. 2012 is when the VA really dove into looking at PTSD and suicide by veterans. And they found that in active duty military personnel, there were 177 active duty soldiers that committed suicide that year. There were 176 that were actually killed in combat. So when you look at that, just as many soldiers took their own lives as were taken by the enemy or the people that they were fighting abroad. That's pretty staggering. Now, as far as it goes, as far as for actual veterans, so not active duty service member, it's estimated in 2012 that every 22 minutes a veteran takes his life, or 22 veterans a day, I'm sorry, or one every 65 minutes. Is what that comes out to. So some people like whole numbers. So in 2012, that totaled 6,500 veterans took their own lives. And in my mind, they're still a casualty of war because it was the war that caused them to take their own life. So what actually happens to the brain during PTSD or during that traumatic event, and what causes the PTSD to do what it does, what causes the flashbacks, what causes the anger, what causes the suicidal thoughts, and then what causes those to become an idea or an action or to take place. And so what ends up happening is the traumatic event actually causes one of the brain waves to spike, okay? And when the brain wave spikes, a lot of adverse thoughts can happen. And usually what ends up happening in a normal functioning brain, when a brainwave spikes, the other ones will come up and kind of bring it back down and say, not a good idea, let's come back to reality, and let's understand that this is not a good thought or this is not a good action. But when you're experiencing the PTSD or even severe depression, what ends up happening is the stimulus happens, whatever that might be. So it could be a smell, it could be a sound, it could be a taste, it could be a thought, a memory, it could be anything. And in the brain, it bypasses a lot of the control matters in the brain, so that brainwave will spike. And that's where a thought of suicide or an anger or flashback or different things like that actually occurs, is when that brainwave spikes. Now, the more that those things continue to happen, the longer that brainwave stays spiked. So the first time that thought happens, that brainwave may stay spiked for just a little bit and then come back down. And then the next time maybe the soldier has that suicidal thought, the brainwave stays up a little bit longer and then comes back down, eventually to the point where the brainwave spikes, and it takes a long time for that brainwave to come back down. And that is why soldiers tend to have, I don't really want to say success rate, but a higher rate of successfully committing suicide. Compared to the rest of society, it is about 30.8 out of every 100,000 soldiers will commit suicide, combat soldiers. Whereas in regular society and people of the same age, it comes out to about 20.8 out of every 100,000. And 90% of those are males. So what treatments are available? Well, many of you have gone through the VA or different things like that. The psychiatric help that's there, I mean, it is there, and you have the Clay Hunt Act, which was a bill that was passed, which is supposed to give you advanced treatment into mental health. But there's a lot more hoops and everything to jump through than just going in and getting the help, especially when you need it. So what ends up happening is you get into your psychiatry appointment, And the first 15 minutes, God forbid if your meds aren't working, because then they turn around and then they talk to you about the new med they're going to put you on. And then they spend 15 minutes to 30 minutes describing the new med for you. And they seem to always be 15 minutes late. I don't know why. So now you're 40, 45 minutes deep into your hour appointment, and now you have 15 minutes to talk about your real issue. But then as a veteran who has dealt with those issues, it's hard to actually open up to somebody who's never been there or never experienced it. And I know some people say, well, they're professionals, but it's hard to open up about 100% of everything that you had to do, especially as somebody who doesn't understand war, doesn't understand combat, doesn't understand that in a split second you're making a life or death situation choice that you feel is the right choice at that time given that event. So you make that choice, and the choice that you make, you can't reverse. You can't take back, nor can you take back those thoughts or those memories. And to have to sit there and tell somebody, a lot of times the soldier feels as though that person, even though they act professional when you tell them, they're going to turn around and judge you after they walk out, or they're going to try to figure out and engross how that decision was a good decision, or how you felt that that was a good decision. So many times, us veterans, we don't fully expose our true demons to the therapist, which makes the therapy not as successful as what it could be. And it's hard, because you don't want to be judged, and you don't want them to look at you like that person, that, you know, those decisions you had to make. The medications, a lot of the medications make you a zombie, especially the worse off you are, the harder you're having issues with different things. A lot of those medications put you in a trance, make you sleep unlimited hours, different things like that. And some of them can actually cause even worse hallucinations, which is not good with flashbacks and different things of that nature. And then they have like the group counseling, which for some people that works. For me, group counseling did not work. I was not a fan of it, you know, so it's hit or miss there. But the problem with all these treatments is that they're not a cure. They're not permanent, right? So a lot of these treatments are a cover-up, or they're just trying to mask a lot of the symptoms, and they're not actually treating the brain, which is the problem, right? Like I described before with the brainwave spiking and different things like that, none of these treat the brain. So the permanent solution is actually neurofeedback. Neurofeedback actually treats the brain. So what neurofeedback does, and there's a few different systems out there that actually treat the brain. Dr. Bill Scott designed the system that I use in my office, and the reason his is specifically designed for PTSD. So he developed this alpha theta protocol, which is a little more advanced than the other systems out there. It's all pretty advanced, but with the alpha theta protocol and Bill Scott's system, if you imagine a brain wave as a wave of water in a normal functioning brain, the water, all the waves kind of go together and they're harmoniously and they look great and everything else. In the dysfunctional or the PTSD brain, you might have one that's flying way up like a tidal wave in the middle of all these calm waves. Most of the other systems just look at the peak and the valley of the brain waves, and that's what they use when they're treating the patient. They're looking at the peak and the valley and they're trying to bring them all together. But the brainwave's not that simple. It's not just a peak and a valley. It's a peak, a valley, and then there's things along the z-axis. So it's a three-dimensional kind of, if you vision it like that, it's a three-dimensional kind of wave. So when you're only treating the peaks and valleys, you're still getting good results, but you're not getting full, complete treatment of the entire dysfunction of the brainwave. So inevitably, those treatments usually take longer, and sometimes, every once in a blue moon, you can actually revert the veteran back on the ones that only treat the peak and the valley of the brainwave, which is a scary situation. Whereas with Dr. Scott, the system that we use actually treats the functioning brainwave in a three-dimensional pattern, so the entire brainwave is analyzed the entire time. So what that ends up giving us is that gives us faster results, and results are permanent, unless the veteran has like some kind of like slips and falls and hits their head or some kind of like trauma like that, that can revert back some of the symptoms. We can always retreat, but usually it's about 10 to 20 visits and we give them their life back. So you can take somebody that's actually in a hospital scene, or they're actually admitted into a psychiatric ward, and anywhere from 10 to 20 visits, you could have them back to normal functioning again. And Dr. Scott is also taking his system. He works with the U.S. Army and a lot of the militaries as far as on their bases, treating PTSD for different med boards and different things like that for people that are going to be getting out with PTSD. So it's very effective, it has a great result, and you're able to give these men and women their life back, which for the most part, very few people have been able to do. So